Next up, we have the Pqi Quality Standard series. What we're trying to do each month is we're looking to highlight a different Pqi Quality Standard as part of our series, because Pqi recognizes the importance of developing, endorsing, and continually improving these quality standards. They were created to elevate oncology practice performance, specifically focused on the dispensing of oral medications in an outpatient setting. This month, we have Eileen Peng of Regional Cancer Care Associates in New Jersey to discuss the PQI Quality Standard. Eileen?
Hello, everyone. So I'm going to discuss the second Pqi Quality Standard, Positive Quality Interventions, PQI, also known as, will be performed by the Medically Integrated Dispensing MID team. And we usually use electronic medical record, EMR, pharmacy software system, and other available resource can be utilized to coordinate all aspects of the medication dispensing and to ensure patient safety. All the PQIs should be documented in the patient's medical record to ensure that any information related to the dispensing of the oral medication is tracked and available to the MID team. It's very important. Next slide, please. Pqi PQI quality standards serve as a guide for our members. We have 7 recommended standards in the guide. So the number 1 is the clinical reference tool. Pqi actually established and will continue to maintain clinical reference tools on the Pqi website. And we all have heard, listened to Jody's presentation earlier. That's give us a better taste of all these clinical reference tools Pqi's website have. So practices should consider utilizing these tools to ensure the dispensing team can offer accurate and consistent information to our patients. Second item is patient education. Also, Pqi website archives some education materials that have been reviewed by the Pqi leadership and also follow a standard template. We all encourage you to take a look and start utilize it. The third item is the inventory maintenance. A practice should really maintain adequate inventory. Of course, we don't want to increase our inventory costs, but also keep in mind that we should provide at the ready dispense, meaning whenever there's a prescription, we should be able to ensure a timely initiation of the therapy to cut down the turnaround time. The fourth item is a very important item that pharmacists need to validate all the prescription prior to dispense. We need to review the indication, treatment schedule, ensure there's no drug interaction, and most importantly, confirm with the physician this patient's ready for treatment. There's no treatment holiday or anything before we ship out the drug for dispense. The fifth item is the patient follow-up cost. So cost to patients are very important element of patient costs, especially when we're initiating a therapy. So Pqi recommend that practices make an outreach phone call to patients within 7 days after dispense in order to follow up on education, compliance, or toxicity issues. Subsequent costs then will depends on the individual patient's need and assessment after the treatment. This also, I would think this number 5 related to number 6, which is the safety. So the dispensing team should verify the toxicity evaluation and management visit with the provider has been scheduled. The recommendation is to schedule this appointment approximately 2 weeks after the initiation of any new oncolytic therapy. So 7 days we give a call out to them, and then 14 days we will follow up with a phone call. And if a patient does not pick up a prescription or accept the delivery, we should reach out to the MID team or prescriber. And the number 7 is patient assistance. So the goal is we ensure that patients all have access to their oral treatment. Without this access, then nothing can go on. And that will be my presentation for the day.
Thank you so much, Eileen.